In this video, we'll use the Synoptec clinical documentation system to customize a pathology reporting template for clinical research application. Synoptec uses responsive templates to streamline electronic medical reporting. With Synoptec's Designer module, clinicians can customize these templates by configuring terminology, adding new data fields, and determining how the template responds. For pathologists, Synoptec comes preloaded with College of American Pathologists electronic cancer checklists, like this template for kidney nephrectomy. If your lab is participating in clinical research, it may be useful to create a new section to record research criteria like patient gender, height, and weight. Let's add observable gender as a field. First, we'll create a synoptic list for it. Synoptic lists are used to create the multiple choices for drop-down menus, radio buttons, and checkboxes. Now we can drag a radio button field into our research criteria section and assign our synoptic list. Our new designs can be immediately previewed and tested. We can save our progress and come back to it later. Don't worry, our changes won't affect other clinicians until we finalize the template by publishing. Rather than adding new fields, sometimes it's best to reconfigure existing fields. For example, your lab may refer to specimen laterality as specimen focality. Let's make this adjustment to the terminology used on the template, and let's make sure this question is mandatory. If your lab communicates with other clinicians through standardized codes like ICD-10 or SNOMED-CT, these can be input in the Designer module. This ensures that captured data is interoperable, even when terminology has been customized. When previewing the template, you'll notice there are fewer questions than there are in the Designer surface. This is due to Synoptec's responsive templates. Follow-up fields only appear when the responsive template knows that they're relevant. Let's add our own smart field so we can capture additional details without cluttering up our report with irrelevant questions. We want these height and weight fields to appear only when a clinician has indicated that the data is available. Let's select to hide the field when inactive. For users experienced with JavaScript, this next step is just a simple line of code. For the rest of us, Synoptec comes preloaded with snippets of code to help create smart fields without computer coding experience. After telling the script about our root question, the template knows which answers should make this follow-up field appear. If we have a patient's height and weight, we are able to calculate their body mass index. We can run calculations with our smart fields, similar to working on an Excel spreadsheet. Again, we can use Synoptec's preloaded code snippets to help us calculate BMI. And now, without computer coding experience, we've extended a CAP electronic cancer checklist for clinical research use. To learn more about the latest and best practices in clinical documentation, follow Synoptec on Google+, or visit our blog at softworksgroup.com.